Hello and welcome to this premiere episode of this new season of Technovation. My name is Dennis Omondi. In this episode, we are going to feature Ashton Onyango, who in collaboration with Wendy Kinara have come up with an invention in technology, an app actually, that is going to revolutionize the health industry. Let's get into it.
Patients in Kenya meet several obstacles in their quest for quality healthcare. Fact is, some of these are preventable through innovation. This is where Ashton Onyango and Wendy Kinara, the two co-founders of MedAssist, come in. Wendy is a medical researcher. Ashton is an AI and biomedical engineer. A very good mix of expertise to give life to a life-changing application that is about to revolutionize healthcare diagnosis using artificial intelligence.
I just am Ashton, But professionally, I'm a data engineer by profession, or an AI engineer. That's what I do. And that's how the whole idea came about, using these tools and technology to try and solve some of the most pressing challenges in healthcare and society at large. So that is Ashton. I like to solve problems.
As a self-proclaimed problem solver, Ashton is in this moment using MedAssist to solve misdiagnosis, which has often left patients with complications and even death in extreme instances. Other problems to be solved include delayed medical treatment, easing pressure on the inadequate hospital infrastructure, limited access to diagnostic tools brought about by an ever-growing demand, just to list but a few. MedAssist promises a cure, that is, an accurate and timely diagnosis.
So this problem is the situation in our hospitals, especially in our underserved communities. You can talk of the areas which are insecure. You can go to areas like Baringo and the northeastern parts of Kenya, and then Tana River, where we have unrest, and just other areas that are poverty-stricken and or affordability to healthcare is restricted in terms of the income of those households or the distance to the healthcare institutions. So you see, that is a real problem. And why it's a problem is because we usually have delays in accessing these healthcare services.
So, what inspired Ashton and Wendy to make MedAssist? It all begins with Karim, a young man residing in a little-known remote village in Tana River County of Kenya's coast.
So Karim lives in Tana River. He is a very charismatic and vibrant guy with a good laugh. So his friends noticed that he came up with a very dry cough, right? And his laughter was soon replaced by a persistent cough. And sometimes he would have blood drops in his cough. And upon going to the local hospital, which is, mind you, 12 kilometers away, that's quite a distance when you're seeking health services in such a condition. He got an x-ray, and of course, from the x-ray, the radiologist gave the interpretation, the doctor made the final say, and he had pneumonia, right? So he was put on medication for pneumonia for about 3 months, but he kept getting worse, right? So this affected all his other areas like his joints, his knees. He became weak overall, his body shriveled, and it was no longer a case of pneumonia, there was something else. So he couldn't get a hold of the doctor at their local hospital again because of the long list of appointments. So for him to see the doctor again will have to be in 3 months later, but he did not have that time. So he opted to come to Nairobi at one of the major hospitals, and another x-ray revealed that he actually had TB, advanced tuberculosis, because it was not addressed at the point at which it was supposed to be addressed.
Turns out, Karim had developed advanced TB and his lungs had been irreversibly damaged. Misinterpretation of a radiology document handed Karim a lifelong medication. But just how accurate is this AI assistive tool, and just who or what exactly is answering the user?
The technology behind it is an AI tool, largely, ironically, large language models. So these large language models you're very familiar with, maybe just not by the name large language models. So talk of ChatGPT. Meta, Facebook, currently Meta recently released their own version of a large language model called Llama, L-L-A-M-A, Llama. So it's also a generalized model that understands human language or human speech, and it can give response with the same measure based on what it understands. So the powerhouse behind this application is this generative AI tool, or the large language model. So it's not specifically ChatGPT. We won't reveal yet what exactly we are using, but it's the foundational model upon which we build the app. We build the app around it. So it can take an image and a text at the same time and give you a definitive response. This response is not a diagnosis. It's not a prognosis either. Let's say it's a decision support tool. So it helps you with certainty confirm what your fears are, or let's just say ease your fears, because it can also tell you this is not what you're suffering from. Yeah, so it's not a diagnosis too. The app is called MedAssist because we are looking to build an assistive technology, right? It's not replacing anyone. It's trying to make the process faster. It's trying to come and cover the gaps, the loopholes in the system, because the whole thing is a system and it's not a foolproof system. So where we see gaps, that's where we come in and try to solve the actual problems. So overall, the oversight is by a human person, right? So there are like agents who constantly monitor conversations. They look at everything that goes on, or anything that warrants their attention. The AI model is able to do that. Like if it realizes this person's situation is a bit complicated, that's when it can bring in a human person, a human doctor, not just a doctor, a human therapist, a human nutritionist, right? So you could be even asking a question about your diet, not just about something you're suffering from, or a meal plan for maybe you want to lose some bit of weight, right? You wanted to give you a meal plan. If it's been trained on that with meal plans that's just data. It's been trained on that and it knows the exact meal plans for this, so it can generate that kind of information for you. But when it's a complicated situation, let's say it's a mental health issue, you are depressed and you're feeling suicidal, and you can't really leave the AI to talk to you if you are at the point where you are probably suicidal. Yeah, right. So that's like an advanced case of mental illness or mental unwellness. So in this case, it transfers you to a live therapist. So in other cases, a live doctor or a live nutritionist, whoever is the healthcare professional behind it. And from there, they can be able to now give you a definitive diagnosis or a definitive counsel.
All right. We are due for our break here. We are coming back with more, including even a detailed information about how MedAssist works. Don't go too far.